So if someone were to make an inquiry, what we would arrange is undertake a brief screening and then invite them for an assessment. What we'd also encourage is that they bring a family member along, maybe a spouse, a partner, just so we obtain a whole history, a holistic history. The assessment process is, for me as a consultant psychiatrist, looking at what impact their addictive behaviors is having on themselves, either physically and psychologically, looking at the reasons of why they may have engaged in this type of behavior, and then looking at any impact on the family and their occupation. And often there is a massive impact. The assessment would also be of their physical state, so we would have a specialist GP or a physician undertake physical investigations. As is very well recognized, use of alcohol and drugs causes not only psychological harm and dependence, but also causes physical harm. So we would have a barrage of investigations, be it from blood tests of looking at liver function, through to MRI scanning of brain function, perhaps even having a neurologist looking at any cognitive processes. Following that, we would arrange for an assessment by a psychologist to assess any needs that they may have of distress or sort of anxiety. Following the assessment, we would then have a meeting of all the specialists and produce what our recommended diagnosis and recommendations for future treatment. Now, that would very much depend on the assessment and the diagnosis. And any treatment that we offer would be in an integrated fashion. It would not just be reducing alcohol or drug use. It would be looking at the underlying reasons for use and treating both simultaneously. And then we would hope to deliver that treatment within our premises or perhaps the person's home. So we have a large estate. We have various sort of accommodations ranging from 3 to 7 bedrooms, all in the central London area, primarily around Mayfair and Belgravia. Or if needed, we could offer the service within the person's home. Obviously, we'd want to do a risk assessment to ensure that it was safe for them, but that is possible too. Treatment then would be using those particular specialists to engage in a treatment program. So my role as a consultant psychiatrist may be overseeing a medically assisted withdrawal from, say, alcohol or sleeping tablets, opioids, or whatever. And that needs to be done in a safe and careful manner. Alongside that, there may be a physician involved, a neurologist, a liver specialist, to look at any treatment needs they may have. If we were to do a medically assisted withdrawal, we may look at replacement of nutritional deficiencies, maybe vitamins or minerals, to ensure physical health and well-being. A psychologist is most likely to be involved for treatment of any underlying distress, be it anxiety or depressive disorder. We would have a recovery manager, because physical health is an important aspect, but so is psychological and spiritual health. So the models of treatment we would use is typically abstinence-based, where we may use cognitive behavior therapy or dialectical behavior therapy, depending on need. Certainly with a recovery approach, so relapse prevention would be important. How to address craving for drug use or alcohol use would be important. And look at building resilience, building an armor with the individual, that when those temptations come, that they are better able to defend themselves against that compulsive need.